It's my feel-good breakfast show.
You're still keeping it locked right here on your feel-good breakfast show. Now we're talking about coughing, dry cough or wet cough or wheezing cough. What does your cough mean and how do you know if it's serious or not? Well, we chat to Dr. Fizile Mkhize on the different types of coughs you may experience and how you can treat them.
Hey guys, it's always good to be here, and as always, you guys are looking amazing.
Thank you very much. Thank you very much. We do take pride in that.
Listen, doctor, I have to ask, how do you know if it's a normal cough versus a coronavirus cough? Is there a difference between these two coughs?
So when it comes to a coronavirus cough, I think everybody wants to know what that is, and you'd hope that it was something kind of different. But when it comes to coronavirus, the cough is a dry cough. So it's something we know about. And the fact that you have dry coughs and you can branch out to so many causes for those dry coughs, it tells you that it isn't necessarily something that's quintessentially coronavirus. We are hyper aware because we live in the times that we do, and we're expecting those to be symptoms that we're going to be coming across, especially with the increase in the number of cases. But when you're talking about a corona cough, it is a dry cough. When it starts out, especially in the earlier days, when you actually start having symptoms, generally the first day to about the third day, you have that kind of dry cough. It's quite irritating, and then you start having all the other symptoms that are now associated with it. So in isolation by itself, you can't ever call it a corona cough. It's in a holistic perspective of that person. It's when you put everything together with that quintessential cough that you start having a higher index of suspicion for there to be a potential COVID issue.
All right, so talk to me about how we treat all these coughs. I mean, I'm sure because they're different and they're caused by different things, they should be treated differently, right?
When you look at it as these two things, where you go, okay, dry and then wet, but then are you also looking at somebody who has a fever, and he's looking at somebody who is having aches and pains in the body and has become quite tired, then you're thinking, okay, maybe this is an infective issue. Where else you have other people who have things like gastroesophageal reflux. So you actually have a reflux issue. They'll talk about, okay, yeah, I actually have a bit of heartburn every so often. I take an Eno, and this cough happens when I go to sleep, and at night it's a cough that's there and it's quite irritating, and that's because of the irritation that's happening because of the refluxing acid that's in the stomach, and that's a drier cough, again, wet, dry, but it's also coming along with this issue that's happening at night. You're somebody who has that reflux. Usually singers also have this because of the fact that your diaphragm, and you're always singing, and the diaphragm is such a powerful thing. You tend to also have these esophageal reflux issues because of all that strain that you put into your entire kind of airway system. So it's all just part of what is happening as a holistic look. Are you taking medications? Some high blood pressure medications have a side effect where you get a cough, and people then have to have that changed because they are having those kind of side effects.
At what point, again, would you then say this is the time you should seek medical attention because you're worried or concerned about the cough?
So we talk about time frame. So again, if you're just having the cough, you can kind of wait and see. There's a progression. So when we're talking progression or potentially even the cough, you can have a cough that was dry that now becomes very productive. So the sputum comes out and it changes color. It goes from a clear color to maybe a yellow or green. That's usually potentially an indicator of a bacterial infection. You also talk about time frames. If this cough is persistently happening every single day, it's getting worse. So it's happening not just once or twice a day, but kind of 3, 4, 5 times a day over a week, even 2 weeks. It's starting to affect your workspace. Again, you have to come in and just have to make sure that there isn't anything insidious that's happening. And then you also talk about if there's a fever, if there are other things in the body that are also now happening after that cough has started. It tells me that there's more than just maybe an irritation or a niggle that's there. It's a systemic issue. And that's when I say, come in, see one of us, a medical practitioner, and we can talk about exactly what's been happening. And it's always better to be safe than sorry. So if you really, really don't know, it's just better to come in and we can either help and cure it if we can, or just delay any issues and tell you that it's okay.
Dr. Faiz, as always, much appreciated. Good luck on all of the calls today and stay safe out there.
Thank you so much, guys. And again, just when we're... there we go. Can we just into the... Thank you so much.
Wonderful advice there from Dr. Fezli Mkhize. Of course, all of this brought to you by DILINCT Junior, a cough syrup specifically formulated for alleviating coughs in young children. DILINCT Junior is sugar and alcohol-free and recommended for children 2 years and older.
DILINCT Junior clears a wet cough and thins and loosens chest mucus, suitable for children from the age of 2 years.